بسم الله الرحمن الرحيم. السلام عليكم. النهاردة إن شاء الله عندنا الإندوكراين سيستم. Endocrine system consists of endocrine glands like pituitary, suprarenal, thyroid, and parathyroid, or masses of cells, which is part of mixed gland like pancreas, liver, testis, and ovary, or cells scattered all over the body, which are called Apud cells. In the endocrine systems, no ducts but fenestrated capillaries or blood sinusoid to carry the hormones directly to the circulation. Pituitary gland or hypophysis cerebri, present in the skull, in the base of the skull, in area called sella tortica, and connected to the hypothalamus by the infundibular stalk. Pituitary gland have two different embryological origins. So it is formed of two parts, adenohypophysis and neurohypophysis. Adenohypophysis arise from upward growth in the roof of the mouth, called Rassic's pouch, and neurohypophysis, which arise from downward growth from the floor of the diencephalon. These two parts unite together and forming the pituitary gland in the sella tortica in the base of the skull. So pituitary gland have two components, adenohypophysis, which arise from the oral ectoderm, and neurohypophysis, which arises from the neuroectoderm. Adenohypophysis have three different parts, pars temporalis, pars distalis, and pars intermedia. The pars temporalis with pars distalis forming the anterior lobe, and the neurohypophysis forming of pars nervosa and the infundibulum. The pars intermedia with pars nervosa forming the posterior lobe of the pituitary gland. Pars distalis. Pars distalis is the first part of the adenohypophysis of the pituitary gland. Is covered with a thin connective tissue capsule and supported by a reticular connective tissue formed of cells arranged in groups or branching cords separated by fenestrated capillaries. Cells are classified into two groups, chromophobes and chromophils. Here we have pars distalis with its two components, chromophobes and chromophils. Chromophobe, the major part, 52%, small cells with pale cytoplasm. Some are granular and may secrete hormones. Some are non-granular and are considered as stem cells or exhausted chromophils. Chromophil, 48%, have affinity for stains, classified into two parts, acidophils, 35%, and basophil, 15%. Acidophil have medium-sized cells, are medium-sized cells between chromophobes and basophils, and includes two types, somatotroph and mammotroph. Basophils, they are the largest cell, have basophilic cytoplasm, and they are three types, thyrotroph, corticotrophs, and gonadotrophs. This table differentiates between the two types of acidophils of the pars distalis, somatotroph and mammotroph. Somatotrophs secrete growth hormone. If the secretion of growth hormone increased before the closure of epiphysis, will cause gigantism, while if increased after closure of the epiphysis, will cause acromegaly. And if the secretion is decreased, will cause dwarfism. Somatotroph are spherical cells with central rounded nuclei and acidophilic granules, give positive reaction with orange G, so-called orangophils. Mammotrophs secrete prolactin, which is responsible for milk secretion. They are oval cells with oval nuclei and acidophilic granules, give positive reaction with carmine, so-called carminophils. Both somatotroph and mammotroph by electron microscope have well-developed Golgi, RER mitochondria and secretory granules. Here we notice the pregnancy cells. Pregnancy cells, they are mammotrophs, which increase in size and number during pregnancy and after birth due to increase the level of the estrogen. So the pregnancy cells, they are mammotrophs but increased in size and number. This photo showing gigantism, which due to increase in the growth hormone secretion before closure of the epiphysis, while this photo showing acromegaly. Acro mean peripheral and megaly enlargement. This patient have enlarged parts in his body, mainly the peripheral part, so called acro, his mandible, nose, ear, hands, foot, and also have enlargement in the internal organ, like the liver. While dwarfism, short stature due to decrease in the secretion of the growth hormone. Basophils of pars distalis include three types: thyrotroph, corticotroph, and gonadotroph. Thyrotroph release TSH hormone, thyroid stimulating hormone, which stimulated thyroid gland to secrete T3 and T4. They are rounded cells with central rounded nucleus. While corticotroph secrete ACTH, which stimulate adrenal cortex to secrete cortisol. MSH, melanocyte stimulating hormone, stimulate melanocyte to secrete melanin. Endorphin, which is painkiller, and lipotropic factor for lipid metabolism. They are oval cells with eccentric nucleus. Gonadotrophs two types: FSH secreting cells and LH secreting cells. The FSH in female stimulate the ovarian follicle, and in male stimulate the spermatogenesis. While LH in female stimulate ovulation and the formation of corpus luteum, in male stimulate the interstitial cell to secrete testosterone. Both FSH or LH secreting cells are rounded cells with central rounded nuclei. In bi-electron microscope, all of them have mitochondria will develop the Golgi apparatus, RER, and secretory granules. Here we notice the castration cell. Castration cells on bilateral removal of the testes, the gonadotroph increase in size and number and accumulate excess secretory granules which push the nucleus, making it flattened and peripheral, giving the signet ring appearance like the fat cells. Pars tubralis is an upward extension of pars distalis that surrounds the fundibulum. They are pesophilic cells arranged in cords or follicle of unknown function, but some of them may secrete FSH and LH. Pars intermedia formed of cords or follicle of pesophilic cells with granular cytoplasm, rudimentary in males, but in some species may secrete MSH or melanocyte secreting hormones. Tumors of adenohypophysis are usually benign. These tumors produce excess amounts of hormones that cause clinical symptoms. To diagnose these benign tumors, we should make immunohistochemical methods. What is the immunohistochemical method? We have a tissue after surgical removal from the tumor. This tissue have cells, and these cells have specific hormones. This specific hormones is considered as an antigen. We expose this antigen to specific antibodies for this antigen. As a result of antigen-antibody reaction, we have a brownish color in the cells of this tissue. And so we can examine under the microscope, and we can identify the specific hormone by this immunohistochemical method. The second part of the pituitary gland, neurohypophysis. Neurohypophysis is formed of two parts, infundibulum and pars nervosa. Infundibulum is a collection of axons of the neurosecretory cells which are present in the hypothalamus and connect the hypothalamus with the pars nervosa. Pars nervosa formed of four parts: pituicytes, they are branched cells, and neuroglial cells for supporting nerve fibers, which are the axons of the secretory cells of the hypothalamus, which carry the neurosecretion to the blood capillaries. Hearing bodies, these are acidophilic bodies, and they are the storage form of hormones which contain oxytocin and vasopressin hormone. And then fenestrated blood capillaries surround hearing body to carry the hormones to the circulation. So we have a diagram for pituitary gland formed of adenohypophysis and neurohypophysis. Adenohypophysis, pars distalis with chromophobe, basophils, acidophils, and fenestrated blood capillaries. Pars tubralis, which upward extension of pars distalis and pars intermedia. Then the neurohypophysis formed of infundibulum, which connected pars nervosa with the hypothalamus, and the pars nervosa formed of pituocytes, branched cells, nerve fibers, hearing bodies, and fenestrated blood capillaries. This is a microscopic picture showing pars distalis, the outer part of the pituitary gland, and rich in cells, chromophobe, acidophil, basophil, so it appeared darkly stained, while pars nervosa palely stained because it has few cells type but mainly nerve fibers, so the background is pinkish, and a crescent shape dark stained cells forming the pars intermedia. Function of pars nervosa is a site for storage of vasopressin hormone or antidiuretic hormone and the oxytocin. In the hypothalamus, we have two nucleus, supraoptic nucleus and paraventricular nucleus. Supraoptic nucleus secretes vasopressin hormone, which is responsible for vasoconstriction and water absorption in the kidney. While paraventricular nucleus secretes oxytocin, which is responsible for uterine contraction during labor and milk ejection during lactation. We have other nuclei in the hypothalamus, like somatotropin releasing hormones, which increase or stimulate the secretion of the growth hormone, and somatotropin inhibiting hormone decrease growth hormone secretion, prolactin inhibiting hormone or dopamine, which inhibit prolactin secretion, thyrotropin releasing hormone, which stimulate TSH secretion, corticotropin releasing hormone stimulate ACTH secretion, and gonadotropin releasing hormone, which stimulate FSH and LH secretion. Blood supply of the pituitary. We have superior hypophyseal artery branch into primary capillary plexus in the infundibulum. This plexus supplies the hypothalamus, the stalk, and the pars intermedia. This plexus join again in the pars tuberalis to form portal veins. These portal veins branch into secondary capillary plexus, which supply the pars distalis. And the inferior hypophyseal artery supply the pars nervosa. Another diagram for the blood supply of the pituitary gland. We have the superior hypophyseal arteries, which is in the median eminence, supply the infundibulum, and the branch giving the primary capillary plexus, which are fenestrated capillaries, which rejoin again, forming portal veins. Portal veins branch again, forming secondary capillary plexus, which supplies pars distalis. And the inferior hypophyseal artery supplies pars nervosa. This is called the hypophyseal portal circulation. Pineal gland or the epiphysis cerebri. They are cone-shaped neuroendocrine gland like pine plant. Pineal gland is attached to the third ventricle by the pineal stalk. Pineal gland is formed of pinealocytes, which are the major cell, astrocyte, branching cells, neuroglial cells for support with dark nuclei, fenestrated blood capillaries, and brain sands or samoma bodies or corpora arenacea. Pinealocytes, they are large branched cells with long process which end by dilatation on blood capillaries. They have large pale nucleus with prominent nucleolus as the active secreting cells, with basophilic cytoplasm and by electron microscope have mitochondria, RER, and secretory granules. They are innervated by unmyelinated nerve fiber. Here we have the neuroglial cells or the astrocyte for the support of the melanocyte. Function of pinealocyte: secretion of serotonin at daytime, melatonin at night, regulate gonadal function, so preventing precocious puberty, regulate sleep rhythm, and antioxidant for protection of body cells. Brain sand or samoma bodies, they are calcified secretion which increase with age. They are samoma bodies or brain sands. They are considered the landmark in X-ray to localize any mass in the brain which may displace its positions. Then we have pancreas. Pancreas have head and tails. The head lies in C-shaped concavity of the duodenum. Pancreas is a mixed gland. Have two parts, exocrine part and endocrine part. The histological structure of pancreas is formed of stroma and parenchyma. Stroma, connective tissue capsule, then trabeculae, which divide pancreas into loops and lobules, and reticular stroma, which stand with silver. The parenchyma is formed of two parts, exocrine parts and endocrine parts. The exocrine part is formed of secretory units, which is the acini. Secretory units, which are called acini, and the duct system. This is the exocrine part. This acini secretes the digestive enzyme. The endocrine part formed of islets of Langerhans, which secrete hormones. This is a diagram showing the histological structure of the pancreas. Here we have dark stained rounded structure, which are called the acini. These acini have basophilic base and acidophilic apex. These reddish granules are the zymogenic granules, which contain the digestive enzyme. And this duct system, which carries the digestive enzyme outside the pancreas. And this connective tissue fibers. Here we have pale stained area in the center of the dark stained acini. This area is called islets of Langerhans, formed of different cells and separated with fenestrated blood capillaries. The endocrine portion of pancreas or islets of Langerhans, they are pale areas scattered between the darkly stained pancreatic acinus. They are about 1 million, mainly at the tail region of the pancreas. They are not capsulated but supported with reticular stroma. They are formed of cell masses or cords separated with fenestrated blood capillaries. Islets of Langerhans formed of beta cells 70%, alpha cells 15%, and delta cells 10%. This pale area is an islet of Langerhans. This table differentiates between beta cells and the alpha cells. Beta cells more numerous 70%, while alpha less numerous 15%. Beta cells smaller cells, while alpha larger cells. Beta cells centrally located, while alpha peripherally located. The granules of beta cells are alcohol soluble but water resistant, while alpha cells granules are water soluble but alcohol resistant. Both cells by electron microscope have RER, will develop Golgi apparatus, electron dense granules, because they are active secreting cells. Beta cells secrete insulin, which lower blood glucose and help glycogenesis, while alpha cells secrete glucagon hormone, which increase the blood sugar level. Delta cells or G cells represent 10% of eyelids of Langerhans. They are present in the periphery of the eyelid, contain membrane granules, which is stained only with silver, so we can detect them with H and E stain. They secrete somatostatin, which is anti-growth hormone, which controls the release of insulin and glucagon. Other cells of eyelids: C cells, very few cells, contain few organelles, unknown function. BB cells contain few organelles and few granules, secrete pancreatic polypeptides that reduce pancreatic secretion. G cells secrete gastrin and ganglionic cells for autonomic nervous control of the eyelids. We have a medical applications. The patient who have severe ulceration of the stomach and duodenum and fail to respond to treatment have excessive secretion of the gastrin. So we suspect a tumor of G cells, which is present in the duodenum or in the pancreatic islets. Thank you.